Today's December 6th, 2021. This is Kimberly, and Kimberly came to see me a few weeks ago with allegedly chronic urinary tract infections, and they had given you antibiotics for it and nothing worked, right?
Correct.
And you were miserable
Yes.
with this.
Yes.
And when I did my evaluation with muscle testing, I found a disturbance in your pelvis, an energy disturbance.
Yes.
And the treatment was an injection of ozone on each side of the midline,
Yes.
like that. And would you tell the viewer what happened to you?
And also, I had complained of having chronic headaches too, and you had told me that the headaches, the location of the headaches, were on the same meridian as the bladder and pelvic area. And so anyway, I felt like I had, prior to the treatment, I felt like I had to go to the bathroom when I didn't, and I couldn't hold very much in my bladder. And then also was experiencing daily headaches. And I no longer feel like I have to go to the bathroom, and my bladder, I can hold a lot and hold it for hours. And also the headaches have subsided by about 90%, and I can just kind of send some energy there, and then they go away. But they used to be so overwhelming that I don't normally like to take medication, including antibiotics, which I did 2 years ago. But I've been able to just be almost completely pain-free from the headaches. Are no longer, when they occur, they're very, very mild, and then they go away.
So you're pleased.
I'm so pleased, yes.
Would you have believed it beforehand?
Yeah, well, yes, because my faith is in the kind of medicine that you and Dr. Sue practice. So I could have believed it, and that's why I came to you.
Yeah, and this tells you why medicine has failed in this country, because it just gives you chemicals to suppress symptoms and not look for causes.
Yes.
And we're trying to look for a cause, and in your case, there was an energy disturbance that was messing up with your autonomic nervous system. Now, we want to go for 100% if we can. I'm happy with what we got, but I'm always happier if I get complete.
Yes.
And when I checked you again, you have a scar.
Yes.
Which you have said it's okay to show.
Yes.
Right there.
That's right. Yeah.
Yep. And what's that from?
It's from, I've actually had 2 surgeries, 2 abdominal surgeries. The last one was to remove my uterus because I had a huge fibroid on the outside, and this was close to, it was 20 years ago. And the one prior to that was when I was a teenager. I had an ovary and a cyst removed.
Okay, so pelvic surgery, and that can explain the disturbances down there. Well, today, the deep pelvic points are clear in contrast to when you were here last time. Now the scar is positive, so we're going to treat that. Okay?
Yes.
Thank you. So here we just did the scar. She actually had 2 scars from 2 surgeries, maybe even 3. They were fairly well faded, but it's just, you should know, the viewer should know, that even if the scar is well faded and well healed, there still could be an interference field. And after the injection, it turns red as the energy is released. We just did your scar, and you tell me that you feel...
I feel more energetic. I also feel like my body is like there's no energy blockages. I did sense before you did the injection that there was some type of a blockage from upper to lower body, but I couldn't put my finger on it. And so I feel like more wholly energized.
Good.
Yeah.
Okay.
Energy
thanks.
Flow.
That's what I'm looking for.
Getting good energy down from head to toe.